Greetings! You are now 1 week away from your scheduled surgery. Today I want to review a few important things that Dr. Badman would like you to start, as well as a few medications and supplements he would like you to hold before surgery. First, if you are taking any of the newer diabetic or weight loss medications, specifically the GLP-1 medications such as Mounjaro or Ozempic, please stop these now unless you have been instructed otherwise by the prescribing physician. These medications slow down how quickly your stomach empties. This can be a problem with general anesthesia because if food remains in your stomach or intestines, there is a risk of aspirating stomach contents during surgery, which can be extremely dangerous. Also, if you are taking a blood thinner, such as Coumadin or Eliquis, these medications are generally stopped 5 to 7 days before surgery. Please contact the doctor who prescribes this medication to make sure it is safe for you to stop it before surgery. You may continue your other regular medications, including blood pressure medications, up until the evening before your surgery, unless you have been specifically told otherwise. Dr. Badman would also like you to begin taking Tylenol 1,000 milligrams 3 times per day starting 5 days before surgery. You will continue taking Tylenol for 5 days after surgery as well. This helps reduce your pain after surgery and can make the recovery process easier. Your post-operative pain medication will be called in and ready for pickup before your surgery. The exception is if your surgery is being performed at the hospital. In that case, the medication will be sent to the hospital pharmacy and can be picked up the same day as surgery. By now, you should have purchased the Hibiclens soap and wipes. Beginning 2 days before surgery, please use the Hibiclens to scrub your shoulder and armpit while bathing. You will also do this again the morning of surgery. This helps reduce the amount of common skin bacteria that can cause post-operative infections. If you ordered the Thrive Nutrition drinks, you will drink 2 OptiCharge packs the evening before surgery and 1 OptiCharge pack the morning of surgery. However, do not drink the protein drink after midnight or the morning of surgery, as this may lead to cancellation of your surgery. If you chose not to purchase the Thrive Nutrition pack, we ask that you pick up Gatorade G-Series drinks instead. You should drink 1 20-ounce bottle the afternoon before surgery and 1 20-ounce bottle the evening before surgery. On the morning of surgery, drink 1 12-ounce Gatorade 3 hours before your procedure. However, if your surgery is scheduled at 7:30 a.m. or earlier, you may skip this drink and simply avoid drinking anything until surgery. Once again, please do not drink the protein drink the morning of your surgery. Please contact the office with any questions or concerns. We are looking forward to taking care of you.